Normally, every 6 to 12 months, we all go into a dentist office to get our annual cleaning done to our teeth and for an average checkup. Typically, if people remember, a few days before their appointment, they will either make sure to brush their teeth at least twice a day, and if they really want to be overachievers, they'll floss. According to U.S. News and World Report, slightly over 32% of Americans do not floss at all. We can say there's roughly around 20 of us in our small section. Doing quick math, that is about 7 people who do not floss. Those 7 people could possibly become at a higher risk for gum disease, cavities, bad breath, etc. Today, I will be talking about the importance of flossing it has on our health and why people should do it. My grandma was born in the 1940s, making her a baby boomer. Back then, tons of people did not know exactly how to take care of their bodies, including using sunscreen to avoid skin cancer and also flossing to avoid oral problems later on in life. She estimated that she most likely did not floss for about 25 years of her life. That probably doesn't seem like a lot of time considering all of us in this class around the age of 20, but those years of not flossing can cause serious damage. When she was about the age between 50 and 60 years old, when people started to learn how to properly take care of their body's health, she had already developed gum disease. 3 important points on why people should floss is because it cleans places on your teeth that your toothbrush can't, helps prevent gum disease, and could potentially save your life one day. Now let's go into more detail about those 3 important points about why you should floss. First, brushing your teeth is a great way to clean the surfaces of your individual teeth, but not in between your teeth. Sage Dental Care explains how the bacteria built up in between your teeth can cause more damage than anywhere else on your teeth. This is because bacteria that is able to be removed by your tongue, fluids, or even saliva is not between your teeth. Although the bacteria and plaque can be removed by flossing that has been built up over time, if the bacteria and plaque is not properly removed by the floss, then it will start to eat away at your enamel that protects your teeth, which will ultimately lead to gum disease and cavities. An activity you can do at home to see just how much brushing only cleans your teeth surface is simple. All you need is a corn on a cob and powdered charcoal, or if you don't have powdered charcoal, pepper works well too. Then you just wet the cob and pour the powder all over it. Next, start brushing the cob, trying to get the powder off within 2 minutes, which is the average time people brush their teeth. You will start to notice that the powder will tend to stay in between the individual corn, which is exactly what that bacteria does to your teeth. Brushing alone will not be enough to save your teeth in your later years of life. Now, let's talk about gum disease. Flossing is vital in preventing gum disease. WebMD stated that gum disease is now the leading cause of tooth loss in adults. As discussed earlier, flossing helps to remove plaque that can cause those awful cavities and help to prevent gum disease. If you started to floss only once a week, that plaque is still going to stay there and it will eventually build up and harden into calculus, or another term is tartar. The calculus will build up on your gum line, making it obvious to other people, and especially your dentist. The majority of people who don't floss is because they say they don't have the time. It only takes an extra 2 minutes out of your day, the same amount of time as brushing your teeth. Flossing once a day is enough to help prevent gum disease, of course alongside with brushing your teeth. A question may arise into your head. Do I floss or brush first? Healthline said that a 2018 study suggested that it is better to floss first and then brush. The study indicated that flossing first loosened bacteria and debris away from between teeth, and brushing afterward cleaned these particles away. An excuse people may use to why they don't floss is because their gums bleed. The more you floss, the less you bleed. So that is yet another invalid excuse to use. There are plenty of opportunities to floss, and there should not be any excuses for it, unless if you want your teeth to be decaying at the age of 55. Finally, I will talk about how flossing could potentially save your life. There is a lot more medical information we know now since over the past few years. More specifically, recent research that is pointing to a connection between gum disease and heart disease. People with gum disease are almost twice as likely to have heart disease. Although there are still many questions about how it is related, it should still be taken seriously. Sage Dental Care knows for certain that periodontal disease, which is just gum disease, heart disease, and arthritis are all partially caused by the body's own inflammatory response. By flossing, you might be preventing much more serious health problems down the road. It is always better to be safe than sorry. If someone has gum disease or symptoms similar to it, they should go to the dentist to get it checked out, and going to their primary care doctor wouldn't hurt either. Talking about options with a trustworthy person who has knowledge about all sorts of medical issues is very logical. Think to yourself, what are routines you do every day? Some common ones would be brushing your teeth in the morning, brushing your hair, exercising, putting on glasses maybe, and so on. Once you get the hang of doing something daily, it will become part of your routine. It is so unbelievably easy to put a sticky note on your bathroom mirror or even put a reminder on your phone to remind you to floss. Flossing can and will help prevent gum disease, clean what your toothbrush can't, and could possibly save your life one day. Don't blow it off just because it doesn't seem important now. Your future self will thank you.